World Hearts Day 2024, I congratulate you all and would like to bless all heart patients with best of their life, longevity, and least of the problems those they are facing during these days. I am going to talk about beta blockers. Those are now rejuvenated into the treatment of hypertension. All of us know that there was one time when beta blockers were shunted out of the hypertension treatment profiles or treatment management algorithms because of certain reasons. I believe it is the advent of the beta-1 selectivity in the newer beta blockers that had really changed the scene, and most of the guidelines have started taking up beta blockers once again into the algorithms for the management of hypertension. A non-selective beta blocker is always associated with certain problems, and I think those were the problems. Those actually were responsible for inability to prove their worth in terms of mortality and morbidity in relation to cardiovascular outcomes and mortality benefits in stroke patients. Anyways, beta-1 selectivity no doubt has an edge over a non-selectivity. Not only for smokers, not only for chest disease patients, but also for the patients, those who are non-smokers, but are with hypersympathomimetic drive, are in a similar situation like smokers. They have a heightened sympathetic activity, and this heightened sympathomimetic activity undergoes a sort of tachyphylaxis once a non-selective beta blocker is used, like atenolol or propranolol or anything that was used in the older times. Once we have beta-1 selective beta blockers, the most beta-1 selective beta blocker being bisoprolol, the problem of this tachyphylaxis, the rebound increase in hypertension, and the cardiovascular outcomes related to that benefit are now very clear. There is at least a difference of 10 to 20 millimeters of reduction in blood pressure if the sympathomimetic drive is rightly tackled with beta-1 selective beta blockers. So, hypertension is now better managed with beta-1 selective beta blockers instead of non-selective beta blockers. And this is the reason that most of the guidelines have taken up now they have taken up the beta-1 selective beta blockers, and they have excluded non-selective ones. So the newer guidelines are not only for beta blockers, but they are for only beta-1 selective beta blockers like bisoprolol. I think this information would be a very useful one for you on this brilliant World's Heart Day 2024. Thank you.